A fast and furious HIV epidemic is taking shape in the country, making the Philippines one of only 7 countries worldwide that is experiencing a rapid increase in HIV infection. This is according to the Department of Health and Studies of the World Health Organization. What could be the reasons why the level of HIV infections are increasing? What could be done to contain it? Joining us tonight is Health Assistant Secretary Enrique Tayag. Good evening, sir.
Good evening, Angel.
Sir, how bad is the rate of HIV infection in the Philippines, let's say on a month-to-month basis this year, and what is the trend?
Okay, in 2000, the number of new HIV infections in the country stood at 1 case every 3 days. Now it's 9 cases every day.
Wow. So what are the causes of this rising HIV infection?
Okay. We took a look at the modes of transmission, and in 2007 we saw a shift of the mode of transmission from heterosexual and safe sex to males who have sex with males. And the trend has continued to rise. Presently now, for example, more males are getting HIV infected, and it's between the ages of 20 to 39.
Why is that so, sir?
We hypothesize, and we have studies to prove this, that the social media may have influenced the rise in HIV infections among males who have sex with males. First, the online social networking allows them to get more partners, and so therefore multiple sex partners is a known risk factor. Another is that they continue to get into risky sexual behaviors, and it's unprotected. The United Nations Program on AIDS, for example, reported the country as having a condom use rate for males who have sex with males between 25% and 49%, which is low by global standards. And so this is one of the primary reasons why the HIV epidemic has actually steamed so much that we see no reversion of the trends in another 3 years. But the good news is that all sectors in the society have banded together, and we're happy about this. Secretary Ona of our department has already engaged in talks with the LGBT communities, for example, the lesbian, gay, bisexual, transvestite, to come up with solutions. We have a blueprint of action, but this is going to take a while. But we are going to be very patient, and we are expecting investments in HIV. Global Fund is also helping, giving some assistance to the Philippines in the next few months. The PhilHealth has, for example, a benefit package of 30,000 pesos per person per year. But what is essential here is that males who have sex with males, condoms are not available at the time they need them, and they do not get tested. So this is a call for those who think they are at risk, that you should have yourselves tested. There's counseling before you get a test, so you don't have to be fearful of the test or even the results of the test.
Sir, how about the statistics coming from like in the cases of sex workers and drug abusers?
Oh, that's one of the successes we have in the HIV epidemic. For female sex workers, the prevalence has gone low, and we owe it to the excellent work of the social hygiene clinics all over the country, and we hope that we can maintain that. But we also have concerns about HIV infection and its spread among the populations of persons who inject drugs, especially in Cebu. We hope that we can find a long-lasting solution, but the short-term solutions are there. We are in collaboration with the local government of Cebu and the nearby cities, and we are hopeful that we'll be able to reverse the trends of HIV and even hepatitis C among persons who inject drugs.
So So, sir, aside from us being in the digital age right now, what other reasons do we see why highly urban areas like Metro Manila have high cases of HIV infection?
Call it the signs of the times. There is tolerance now for males who have sex with males. We have a population that is big for the age group 20 to 30, 39, and these are the age groups where are vulnerable, and this is the time that sexual behavior is at its peak, and so therefore we are expecting an increasing trend among this specific or particular population.
How much does it increase, sir, year on year?
Right now, for example, comparing the periods 2002 to 2006 and 2007 to 2012, it's more than 500% increase in terms of annual average of new HIV infections in the country. We also made some estimates because we know that people are not getting tested, so therefore they're not still in our registry.
Right.
Our estimates now done with the WHO and the United Nations that we place the number of HIV infections in the country at over 20,000 for 2012.
That is pretty huge, sir. Now, what interventions are in place, and what do we have certain programs to, convince people to have themselves tested?
Okay. Traditionally, we would everything into ABC: abstinence, be faithful, use your condoms, and D, drugs or antiretroviral drugs for those who are already infected and will require them. But of course, we have to tackle the problem head on, and so therefore the solution is actually found among local governments. So while it is a national concern, the response is local. And because we know that persons who inject drugs, as well as male who have sex with males, are considered hidden populations, so this poses a challenge to provide access to the right information so that safe sexual behaviors would be expected from them. And so therefore we have embarked on an outreach program where we work closely with all sectors of society, and the Philippine National AIDS Council was part of the new focus. We were strengthening its organizational commitments to reversing the trends of HIV, and we have 3 years, because this is a global commitment, to reverse the trend and to reduce by half the incidence or the number of new HIV infections in the country.
So we know HIV can lead to AIDS, and the incidence of death, do you think, is it a major problem right now, sir, in the country?
Right now, the United Nations placed the AIDS deaths in the country as stable, and so that's good news. But exactly, we don't have figures, and it's difficult to trace them using death certificates, because some of the deaths are not reported as AIDS, and they're reported as others. So we are having new ways of trying to find out exactly how many died from AIDS in this country.
Lastly, sir, any final words to our viewers, and especially those who are affected or may be affected with this infection, that they may not know about it?
Okay. Practicing safe sex makes us more responsible as citizens. We should respect life, and we are calling out there to the youth to consider the risk they put themselves into if and when situations warrants that they should protect themselves. So if you're at risk, it is a good decision to have yourself tested, and there are counseling services that are available in government and even in private institutions. And don't hesitate, don't be fearful, because lives of other people also depend on your decision.
All right, thank you so much, sir, for sharing your evening with us. That was Assistant Secretary Tayag, spokesperson of the Department of Health.